In the small village of Asega in Rift Valley, Kenya, life is slow and newcomers are rare. So when these health workers came here recently, there was a lot of curiosity. They are here to test residents for HIV/AIDS as part of an ongoing government initiative. Most people in Asega are farmers and spend long hours cultivating land. The nearest health facility is a district hospital, which is about half an hour's drive away, and many people don't have the time to go there. Faith Nekesa tests about 20 people every day. Before she started working in the field, she was stationed at the hospital, where only about 3 people would come in for tests daily.
These areas are far from hospitals, so that's why we decided to bring our services here, because of the distance and their need. For example, today, there are those who told us how grateful they are because they work on their farms all day and don't have the time to go to town. They don't have bus fare and the distance is long. Some are new here and they have never been tested.
Tabitha Torotich is the clinical officer in charge of the area.
But we, as the Minister of Health, because we are the professionals, we have decided to move out and really assist those communities who are not able to reach the services. Out here, we started recently, about last month, and the number which we tested was 306. Those were positive, negative, and the positive were 28, which is about 10% of what we did. So it's like it is giving us an eye-opener that there's much to be done.
During the testing, participants are also taught about safe sex.
Na iko ya wanaume, lakini wakati ya mwanamke inatumika, ya mwanamume haitumiki, inatumika tu moja at a time.
Kitu kama about 8 months tangu nipimwe, lakini nikawa niko tu swali, na kutoka wakati huo sasa mimi nikajua sasa nitakaa tu vile nimeshapimwa huko. Sasa mnaweza kupima tena,
unaweza pima more than once, kumaanisha utapima ya kwanza, ukae baada ya miezi 3 tena upime ingine. Kwa hivyo kama umewahi pima ya kwanza na uko willing kupima, as long as umemaliza miezi ngapi? 3. Kama umemaliza miezi.
Before he is tested, 55-year-old Joseph Avunga gets some counseling so that he is mentally prepared, whatever the outcome. Samples of his blood are then placed on a test kit. If 2 lines appear in 15 minutes, he is positive. A single line means that he is negative.
This is my second time to do the HIV test, and I'm very glad because it turned out negative. So I can now continue eating stiff maize meal porridge, which has helped me fight all the diseases of this world, and I will also stick to one partner.
According to the government, about 5.1% of the country's 35 million people are infected with HIV. Kenya's HIV/AIDS prevalence rate has dropped by half over the last decade, mainly because of government and donor-funded awareness programs around the country. In addition to hospitals and clinics, there are about 900 voluntary counseling testing centers nationwide. However, many people still don't know their status, and some are skeptical about mobile testing.
The HIV pandemic is a disease that actually killed people in the community. We are aware that people must be tested, but this doesn't mean that I can be tested on the street. This cannot be. This like risking my own life. I can't be tested. This will bring stress and trauma in my life. This cannot be.
Afya yangu is my private affairs. There is a way you can meet me, tuongee, you set up a camp, we talk, you tell me the pros and cons as to why you want to take my status, to know my status. Then thereafter, I will decide. But walking on a street and meeting me and telling me I want to test you so that you may know your status, I can't. I can't.
To intensify its campaign, Kenya's government launched a door-to-door initiative at the end of November this year that hopes to test 1 million people over a 3-week period.